In your morning medical news, as the United States deals with one of the largest measles outbreaks in the past decade, new research shows a concerning trend regarding childhood vaccination rates after the COVID-19 pandemic. Bradley Blackburn has more.
More cases of measles in Texas and New Mexico. The largest outbreak in the country remains in Texas, where more than 325 cases have been reported since January. One child has died.
Unfortunately, post-pandemic, rates of childhood vaccination have not bounced back.
The measles is among the highly contagious diseases that can be prevented with the vaccine. Overall, vaccinations among children declined during the COVID-19 pandemic. Now, new research in pediatrics shows immunization rates for some illnesses still remain lower than pre-pandemic levels.
What we saw in this study, about 400,000 or so babies, looking at their vaccination rates by age 5 months, those have declined over the course of the pandemic from about 88% coverage down to 81% coverage by 2023. And by 12 months of age, these kids had still not caught up.
The study focused on the rotavirus vaccine, diphtheria, tetanus, and pertussis or whooping cough vaccine, and the pneumococcal conjugate vaccine. CBS News medical contributor Dr. Celine Gounder.
We're concerned in particular about certain groups that are lagging behind, including babies of color, people who are low income and on Medicaid, and families that may not speak English as a first language. This is an issue because even tiny dips in vaccination rates can leave communities susceptible to outbreaks.
Dr. Gounder reminds for measles, 95% of the community needs to be immune to prevent an outbreak. Even a 1 or 2% drop can lead to widespread cases.
The U.S. confirmed at least a dozen deaths from whooping cough last year, according to the CDC, the most deaths from the bacterial infection since 2017. The Trump administration is set to cut $11.4 billion in COVID-era funding from local health departments. That money covered things like vaccines, testing, and infectious disease prevention. Minnesota's health commissioner calling the move sudden and unexpected, impacting $226 million in grants. It comes as the CDC reports an average of 458 Americans still die weekly from COVID. Many of us have been there. Painful burning sensation after eating. GERD, short for gastroesophageal reflux disease, is better known as acid reflux. It is a chronic condition that affects about 20% of Americans. The most common culprits are caffeine, alcohol, and fatty foods.
Bottom line here, talk to your healthcare provider. This is tricky to know when to get an upper endoscopy, when you actually look to see what's going on. It can be some serious stuff, or most commonly, it's something that can be treated with medication, diet, and weight loss.
To prevent acid reflux, experts say avoid trigger foods like chocolate, mint, and spicy foods. Don't eat in the hours leading up to bedtime. Take an antacid and elevate your head in bed.